Good day. I'm very excited today because we're going to finally get to the root of things. It's a real nerdy endodontist joke. But before I make this even more awkward, I'd like to welcome on Dr. Alexa Martin. Where are you located, Alexa?
Hi, Mark. For the awkward endo joke, I'm glad you didn't go with the awkward Amazon Alexa one because that's a
That was going to be the next one, but I find the more I talk on the intro, the probably the more I lose people. So
okay, yeah, let me go. Um, so I'm Alexa Martin. I'm an endodontist in Beverly Hills, California, right smack in the middle of LA. I've been here for 4 years. Well, I grew up here in Manhattan Beach. My dad's had a practice here for like 30 years in the same building. And I just took over actually as of last Monday.
Oh, wow. Okay, so is your dad's an endodontist as well?
Yes, he is.
Wow, multi-generational
Still
endodontist.
hanging around seeing patients for a few days.
Yeah.
Trying to keep him around as long as we can.
Cool. So what was that like growing up with an endodontist dad? Obviously, you think your dad's pretty cool because here we are.
Yeah, but to be honest, when you're a kid with endo, you don't know I didn't have a clue what he was doing. I was just like, oh, cool, I get to go to Beverly Hills and hang out with the front desk and like she'll take me to Sprinkles Cupcakes. I had no idea what he was doing.
Yeah.
Just that he went to work every day and then he came home by dinner time.
Yeah.
And then in college, I was kind of like, oh, wait, what do you do again? That's pretty cool.
Yeah. Yeah. So obviously that was your gateway into it all. What do you love the most about being in the industry and specifically in your specialty? What's your favorite part about doing what you do?
Endo in particular is a niche. You gotta really want to do endo to want to do it. But you're taking someone who is either coming in pain, is terrified that you're gonna torture them, or both of those things, and you're resolving their issue in one visit. They're feeling better, and they're coming out of the chair going, "Oh my God, that was so easy. Thank you so much." Mm-hmm. There's this misconception that root canals are so awful and torture, and I'd do anything. I'd rather have a root canal. But it's really gratifying.
Yeah, I like my friends and family that inform me that they're going in for the dreaded root canal. I'm like, cool. It's like a really deep filling. It's like
That's exactly what I say. I said It's like a filling. It just takes a little bit longer.
Yeah, it's like a really deep one. So where are your patients coming in from? Obviously, you must have a pretty decent referral network, being that your dad is pretty established. So that's nice. Where are you seeing patients? Where are they coming in from?
Yeah, that made it really easy right off the bat because he does have like all the best guys in town referring to him. And then because I'm related and they've kind of known me over the years, it was pretty easy to get going. But I mean, even on our block, there's like 100 dentists. I'm on Bedford between Santa Monica and Wilshire. And there's even an endodontist upstairs. So there's dentists everywhere. But it's been fun because I got out and COVID hit like 6 months later. So I was still kind of seeing patients, but everyone was just hanging out on Instagram all the time. So what was kind of cool was getting to meet a lot of these younger, newer dentists. And there's just so much technology and change in communication with dentistry that I've kind of started just networking that way and meeting new dentists and them getting to know me. It's not kind of the traditional stop by with a box of cookies and take them out to lunch. Like we don't have time to go out to lunch these days. We're like,
nobody does. Yeah.
No. So it's been fun. I've got my pretty good network of, they're friends now and we're texting all day and talking about patients and sending photos of the cool MB2s we find and stuff like that. So
nice. Yeah. And I, it's so important for that GP to have a great network of specialists surrounding them, so not only, maybe the case isn't referred out, but just having that, that extra level of knowledge in your corner is super helpful. I imagine you're getting text messages all the day about cases.
Yeah, we have some fun too. Actually, last night, a female oral surgeon that's in town, Brittany Sonicson, hosted. She always hosts these women in dentistry events. And last night there was like 30 dentists, and we went to one of those, trendy wellness places where you can get an IV or do cryo. They had hyperbaric oxygen chambers. So there was like
Crazy.
30 of us getting facials and hyperbaric oxygen. Everyone had a long day of work, but it was fun. It
How
was
do you
good.
feel? You must feel like amazing today.
Yeah, it was 20 whole minutes. You're supposed to do it a lot longer.
Mhm.
But, you put on oxygen, so you're feeling a little dizzy from the oxygen. I couldn't tell if it was cellular regeneration or just that. But
Yeah.
yeah, it felt great.
Cool. Yeah. And then like a vitamin IV drip sort of thing.
Yeah, well, I ended up with walking pneumonia last month, which is really fun.
Ooh.
So I've been doing and researching a lot of this biohacking stuff anyway. But last night we just stuck to the oxygen and facials and red light therapy.
Yeah, oxygen's pretty good for you. It's backed by science. What's exciting in your niche right now? What are you like? What's coming down the pipeline? I like. It's always interesting to me. The implant versus let's leave that root in and work off the root situation. Where do you see your field going right now? Technology wise, just I want to pick your brain there.
Yeah. So I mean, the CBCT is the 3D imaging is pretty standard of care now, and the one we use in endo is way more limited exposure, like limited field of view. So it's not like the full head one you get for an implant. It's so localized in. We can see the canals, we can see the cracks. So it just gives you so much information ahead of time to plan and to figure out what's going on. And then the technology we're using, the electric hand pieces, the irrigation systems, everything's less invasive and more predictable. So you can convey that to the patient. They understand. They're more confident. It's not just this like, oh, I go to the doctor or the dentist and they do something and then they give me a bill. Like they're part of the process. They get it. We just got delivered today our Gentle Wave, which is a pretty big deal in the endo world these days. We're very excited about it. And it's this device that's kind of like a power washer for the tooth. And it gets into all these areas of the tooth that your instruments can't get into and disinfects everything. We haven't really seen it increase the success of root canals because root canals are pretty successful, but it helps us get into these areas that we otherwise maybe couldn't have saved a tooth for.
Cool. So you're saving more. You're having a better success rate with this technology. That's cool.
Yeah, and less post-op pain because you do all this planning ahead of time, and then I tell the patient, we get in and we get out as fast as we can without doing collateral damage. So it's making the whole process a lot easier. It's shorter time. Yeah, it's less visits. You don't have to come back.
Yeah. Less invasive, I guess, right?
Mm-hmm.
Cool. So the technology behind it is just a higher volume of material that's more specific, more focused on the canal, or
hold on, I'll save you here. It's like a suction on the tooth, and then it uses a negative pressure system that runs. We usually use like a Dixie cup size amount of disinfectant. This is like on supercharge, and it runs all this fluid through there in 8 minutes, and so it just has to be cleaning better if it's doing it that way.
Makes sense. Okay.
Have you had a root canal before?
I have. Yes, I have. Yeah.
How'd it go?
It was great. I went to an endodontist here in Vancouver, British Columbia. Obviously, being that I talk to all sorts of, I'm in the industry, so I know what I'm getting myself into. It was completely painless. It was on my I have the Canadian tooth system, so it was on my second molar, the one with it's got an extra canal or a hidden one or whatever. It was a real difficult one for my GP to get into. So that's, I think,
Isn't that bad, right?
it wasn't bad at all.
Yeah.
I mean, I wouldn't want to do one every day, but if I had to get one again, yeah. And it was like a quick, like the beginning pros, the consult. I had the CBCT done. Being the more you can inform your patient, the less anxious they're going to be. So, what tool, like what's the standard of practice now in your practice, like across the niche? Like what tools do you need to operate these days? And also, what tools are you using for patient communication so they understand what they're getting themselves into?
Yeah, the biggest kind of change I've done, and it's not just your tools, but I feel like even more than your tools, it's prepping the patient and getting them comfortable. Like, they don't know what the heck you did in your tooth, but if they're happy walking out of there and they're not scared and they go back to their dentist and they said, wow, that was easy, I fell asleep, it's successful. So I bring everybody in for a consult first, and I've really communicated with my general dentist. I've made like a custom referral that asks all these questions. So by the time that person walks in the door, my front desk knows who they are, knows if they're in pain or not. I know what's going on with them. I've seen an x-ray. I kind of know what the plan is. I take the scan. I sit there. They come in, they see the office. We have a really modern office, but I said I'm trying to make it as much like a spa, to strap for everyone as possible. We have a fish tank and this grass cloth on the walls, so it doesn't look like a dental office. So just getting them in the door, calming them down, talking to them, figuring out what they're afraid of, what part of it they don't understand, why they might not trust a root canal, getting through all that, and then kind of figuring out, okay, do you need some sedation? Would that make it a lot easier if we give you a Xanax beforehand? So that the day they come in, it's just like, boom, they're ready to go. They know what they're doing. I'm numbing them. I'm walking them through that, making it easy. And then I usually use a few hand files, it's funny because my dad still does lateral and his endo looks amazing. But hand files up to like a 30 on every canal. And I'm like, and he's so fast. And that person's head's like shaking on the table. And he's like, oh, sorry, you didn't mean to shake your head off the table. Like, but he's so fast. I'm like, my little fingers would fall off.
Yeah. But how many years has he been doing it for? Sorry.
Since 73, 83, 93, 03. Whoa, wait. No, not 73. 83. So like 40 years.
Yeah, he could probably do it with his hands tied behind his back.
Yeah, it's fun. But I mean, his style is just different than mine. So he gets it open with the hand files a lot more. I keep it smaller. And then we both are using the Vortex orifice opener, which is, dentists will understand this, or endodontists maybe. It's like a 2508. So it's skinny at the tip and then it goes up a little fat, but you don't want to go in very far. You just go in a little bit with it and kind of open it up. Then I'm using Wave 1 files. I usually start with a yellow in every canal and then go up to a red and maybe a green.
I'm familiar. I spent some time with Henry Schein. I'm familiar with that system. Yeah,
it just works. And I mean, knock on wood, doesn't snap and just comes out predictable, goes to the end. But I'm kind of excited with the gentle wave because the Wave 1 does all these waves. We're in California. I guess we got to use them. Yeah. It's a little bit big. It's a little bit big. You see on Instagram, everyone's doing these small shapes now. And I didn't want to change my system right when we were getting the gentle wave because it's like you got to just change one thing at a time. So we're going to do gentle wave. We're going to get good at it. And then we're going to slowly kind of modify what we're using. And then I'm using BC sealer, bioceramic sealer, warm vertical, BC liner, sponge, IRM, CF.
What's your favorite tooth to work on? What like when you're looking in the morning and you see your patient list, you're like, oh yes, I'm doing this one today.
I mean, probably an upper first molar.
Yeah.
Yeah, it's so easy to see.
Yeah.
You're gonna get numb. You're gonna be like a superwoman when you find that MB2.
Yeah.
It's easy to fill, and it's not as much post-op pain. So.
It's a
I have 4 upper molars on my schedule. You'd have a good day.
yeah. Awesome. What are you talking to your referring GPs? Like, how are you framing the conversation with them in terms of sending folks your way? What's that conversation like? Is there some like material that you're giving them to pass out to the patient? How does that workflow work? How does that work?
Yeah, I got bored during COVID and like designed a brochure with just like pictures of myself in the office and like the 10
Like
most.
smiling with thumbs up, right?
Yeah, like looking like not scary in my dental office. But it's kind of like a little referral. It has like the map and answers all the questions you have. But really, I tell them, you know, your job is not to, you don't have to diagnose, you don't have to explain what's going on, if there's maybe a crack, why they're having pain. All you have to do is say, let's get you over to Dr. Martin. She will take care of you.
Mm-hmm.
Like, don't get any farther than that because the patient's going to have all these questions. You might not be able to answer them. Just get them over to me. I'll take care of them. Don't say you need a root canal, it gets done today, because a lot of the time that's not the right answer is going in and opening up. If it's a retreat and it's got a huge lesion and it's failing and they're in agony, if you numb them up and you go in there and you go poke around a bunch, it's just going to hurt more. You're not taking out any nerve tissue. Maybe, or maybe it's a Friday and we're slammed and I don't have time to open it up. Either way, I'm going to put you on an antibiotic. You're going to feel better. And I tell the patient this too. Let's start with some medicine. It'll calm everything down. Then when you're feeling better, we'll bring you back and we'll get going. And there's a better chance that you'll have less post-op pain after. So that's the biggest thing that's kind of helped. And then just reassuring them and understanding why a consult first is important, because who wants to go twice, or who wants to go with a toothache and then have to go back and do the root canal? But I think if you can explain all the factors, because you need to sometimes give them pre-med, or you need to go over their medical history, or they're really scared and you're like, oh God, I'm running out of time, they're not going to get numb, or the tooth needs to come out and then you've lost an hour of treatment time. It just becomes more predictable. So some people were a little reluctant at first, and sometimes they still do it same day if we can and everything lines up. But I just think it's been like a game changer having people come in and kind of go through the motions first.
Yeah, communication is everything, I think, especially when it comes to somebody that deals with extra anxiety. The more information you can give them, the more it alleviates those voids in their minds, those things that they fill into their minds themselves, and they shouldn't.
I'm the same way.
I am too.
45 minutes because I was like, I would probably need 45 minutes to ask all my stupid questions and try to like control the situation by
right. Yes.
So.
I am built that same way too. I need to know. It's one of the reasons like I enjoy this podcast, because I get to understand more. I think the more you understand, the clearer your path becomes, right?
Yeah.
What do you like? How many folks aren't coming back after that first consult?
Close to zero.
Oh, that's good. That's awesome. Yeah.
And I think I'm lucky. I have a really great referral base where they send someone and they know it's a reliable patient and going to work out. We have really good patients.
So all the financing's all the insurance is all talked about and
yeah, we just dropped Delta. Woo.
Oh yeah.
I don't know if I can say that, but everybody understands. That was our last one. But the front desk girls go over everything on the phone before they even walk in. That's another reason consult first. Like, go over the cost for consult, then we'll tell you what the plan is.
You have to. I think for any especially orthodontic treatment, any specialty treatment, I think that's super important.
Yeah, I go to my dermatologist and they're like, you need to pay us $500 before we'll even schedule you an appointment. So I said, come on.
Wow, really? Yeah?
Yeah, you have to I had to make a full deposit. And they were like, if you cancel within 24 hours, you just lose that.
All right, well, you know what? Maybe we take a page out of their book, maybe, right?
Yeah.
Yeah. Awesome. So what's exciting? What's happening in the clinic right now that you're pretty excited about?
Well, what's been so great is the turnover from my dad right now, because he was doing all of the bills, all of the paperwork, always stressed out. He's 69. He's turning 70 next year. That'll be fun. But he just can't keep up with all of it. And
Mm-hmm.
it was stressing me out, probably just because I'm his daughter sitting next to him, but I could feel it.
Yeah.
And then as I started, taking over all these vendors and getting everything set up, I'm like, dude, you don't have anything on auto pay. No wonder you come in at 6 in the morning, like every other day. You're paying paper bills for your AT&T bill. So
Dad, come on, Dad.
Oh, poor guy.
Yeah.
No wonder you can't keep track of him. So I got that all dialed. I hired another front desk girl. She's wonderful. She was an endo assistant for 3 years. So she transitioned up front great because she can explain things to patients when they're scared and calling. But we've just got a really good vibe going. And my dad's relaxing a bit. So it's been really
That's nice. Yeah. And like, what a special thing to for you and your dad to, have that bond and that connection. And there's nothing more important than family. So that's pretty cool. You're lucky. You're lucky.
Yeah. I mean, it's wonderful. And I feel like when you're going into this field, like you either know it's totally going to work or you know it's totally not going to work. And I knew it was going to work, so it didn't worry me at all. But one tip I will have, there's a ton of people whose parents are dentists and you go in with them. Mm-hmm. We were talking about partnering first, like me kind of slowly buying in. And then we kind of realized like, okay, if we're partners, we have to make all the decisions together. And there's going to be a lot of like, he's going to want to do things a certain way and he's on his way out and I'm starting. So I'm probably going to want to invest in more things. So it seemed a little scary, but I ended up just buying the whole practice from him and he's my associate. And I think especially as a family member, like it takes that part out of it and we can just work together and he can just show up and go home. I think the partnership thing would have been way more of a nightmare.
Well, yeah, I could imagine that. And then I'm sure, 40 years, you have a system that just works and it's worked for him. Yeah. And, somebody young coming into there's all this technology now to take a look at that maybe he's seen that he's just kind of like, yeah, no, this has worked for me for a long time.
CT, don't get me wrong.
I can't imagine doing your line, like your niche, without being able to see that canal in 3D. Like I don't think, like it's, wow, what a game changer that piece of technology is, right? And especially now, like the images, the radiography that's coming out of those machines are just getting so much better over time.
Yeah, and the low level of radiation, this is something I tell all my referring dentists. Like the one we take is like taking 2 PAs. It's not like a CT scan. So you get all this information. It's not that much radiation.
Yeah, it's not very many bananas, right?
We were calculating that. We were like, how many bananas are in an Air One smoothie? Air One's just like big trendy. Like there's all the 20 kids in Beverly Hills and Venice over there. We're like, one Air One smoothie has more radiation than my X-rays.
Yeah. Or a flight or whatever, right? To
Yeah. That you can't conceptualize because you're like, I don't know how much radiation is up in the air, and I don't want to think about it because I need to fly to New York. You're not going to not do it, but I feel like bananas is easier to understand.
Yeah. And there's all sorts of cool tools in the market too that use like technology, like this trans illumination that lights the tooth up like a light bulb, and it's just using, regular light waves versus X-ray, right? And I think another thing that's coming down the pipeline that's going to assist in seeing things is AI too. It's going to circle and highlight things, and you're going to, in the end, it'll be less exposure because there's going to be no second X-rays. It's going to be more efficient. So I don't know.
Even like knowing the angle to take it at, maybe would be
angles.
Cool.
Yeah, angles are a big deal. Yeah.
Yeah, they are when you're taking a PA on a lower molar.
Oh, sure. Yeah.
I was thinking, like, the clinical photos on the scope too, and the videos. It helps have the patient be part of it a little bit more too to understand what's going on.
Mm-hmm.
I feel like a few years ago, forever, the average person like didn't even know the word endodontist, like didn't know how to pronounce that. Now it's getting a little more mainstream, and we're changing the narrative.
It's good, and this is great that you're on with me today. Like, what a great opportunity to talk to somebody that's multi-generational too. Um, what would you tell kids in dental school right now? Sell them on being an endodontist. Like, what?
There's no lab work in endo.
Oh, that's
I remember the endo director used to walk past the lab whenever I was working. He's like, "There's no lab work in endo."
that is like, yeah, that's
I don't know. That was the worst part for me. Some people love that stuff.
yeah.
But there's just so much more than you learn in undergrad. When you're doing it in undergrad, it's so frustrating. You don't know what you're doing. You don't have a microscope. You don't have a scan. Like, these teeth are bombed out. Like, that's not endo.
Mm-hmm.
Endo is, think about like your course in endo, like what you learned. Like, what I thought was cool was it's not just all materials. Like, it's biology. You're getting a tooth. You're trying to understand, okay, why is it hurting? Is it the nerves in their face? Is it inflammation? Is it a crack that's setting off the nerves? Is it infection? And how do we treat it? Because it's not just every tooth is the same. It's like, it's not that every tooth is different, but when you're a specialist, there's so many little things you can pick and choose. Put them on antibiotics first. Use gentle wave. Don't use gentle wave. That it does get way more specific, and you end up having way more success. It's not these nightmare root canals you're doing in undergrad where you're like doing this 100 million times and then still can't see or get an x-ray. And then the patient's in so much pain after because you basically jabbed their tooth for 2 hours. So remember that. And if you're interested, go assist the postgrads. They love teaching. So you get up there and you're like, whoa, this is way cooler. And it's quiet up here. And no one's really stressed out. It's good.
Yeah, I like it. Yeah, the whole the lab conversation. That's another. And then finding the right laboratory, and for sure.
There's no lab fees. There's no impression material.
You're more in control of your dentistry, I guess, right? You're more in control.
Yeah, less overhead.
Oh, well, there you go. Business-wise, yeah, for sure. That all makes sense to me. It all makes sense. Any other additional thoughts that outside of dentistry? What's sort of top of mind for you these days in business, in the future of things with AI and all these other cool technologies that are coming through the pipe? Where's your mind at?
It's all coming so fast, and all of us who are dentists, everyone's a perfectionist. Endodontists are like crazy perfectionists over millimeters. This past month for me was so gnarly. Like, I'm buying the practice, I got pneumonia, like all these things are happening, and you think you can just push through everything. Like, we're that generation where as we were kids, people are like, oh, you can be superwoman if you want to, like, you can do it. And like, we all did that and stressed ourselves out and never took any rest. And now we're like, well, shit, now like I'm exhausted.
Yeah.
And it kind of, my body hit a wall, and I'm like, I would never cancel on a patient. I'd never say no to a referral. And I literally was forced to be like, you guys, you have to cancel the rest of my patients for the day. Like, I have to go home.
Yeah.
So in school, you're so focused on pushing and it's just you and do the best. And I've just kind of realized you can't do that in the real world. Like, that doesn't mean success. And so I've tried to have a way better balance, stay in boundaries. If something's feeling too stressful, like, if you do it, you're just going to be more miserable and something bad else is going to happen. You're going to screw up a case. Like, it's okay to say no. You got to rip the Band-Aid off and say no. And then the rest of your day is going to feel better. If you have a patient where you're deciding whether to take the tooth out or do the root canal, and they're being a pain in the butt, and they are, like, you don't have to do heroics. Like, talk to them and say, you know what? I don't think we're a great fit, or what? This is kind of a gamble, and then let them decide. But you don't have to be so perfect all the time.
Yeah, we're human. I think that's such a great message. I think that kind of translates across all of us. I think it is very push, we are all trying to perfect things, and I was talking to a colleague at a coffee shop yesterday, and I use this analogy, right? Like if you get your walls just freshly painted, and you're going around your apartment or your house, and you're looking at the walls, you're gonna find imperfection, right? If you go out looking for imperfection, you'll find it. But if you need to kind of like take a step back and realize, like, it doesn't need to be perfect. It doesn't.
Yeah. And
You know.
you can keep finding imperfections all day long if you're looking for them. You're right.
Yeah. Yeah. Especially those folks like myself that have OCD. So, um, yeah. This has been awesome. Thank you so much, Alexa, for being on the show. I would love to have you on again sometime.
Cool. Well, have a good weekend. Nice chatting with you.
Yeah, you too.
Okay.
Take care.
Bye.
Bye-bye.